to be over here on this side, and you can see his backbone, and then his tail's going to be over here. And in the center right here, this is the outline of the mass. Can you see this big circle right here? It's pretty much taking up the majority of the center of the belly. All of these little loops of kind of black is the gas in the intestine that's all getting pushed back this way. This is the colon getting pushed up this way. The stomach is getting pushed way over this way. Wow. This mass is literally pushing everything else out of the way, which is then, again, making him feel really crummy. And then there's the other view where he's laying on his back. I'm going to switch to that view here. And the same thing on this view. So again, you can see the outline of the mass here coming all the way down here like that.
It's huge.
And you can see all of this getting pushed down this way, and this getting squeezed up here. This is his stomach up here, just getting pushed up against here. And so because this mass is just so all-encompassing in the center, it's literally just making him feel terrible. It's taking up all of the
So it's this?
Yes.
Okay.
All of that right there. Now there's a little overlap, so on this view you can see the colon right here is running across the top.
Oh, okay.
So
when it should be,
normally it's down here lower.
Okay.
But it's getting squeezed up like this. So the colon kind of runs across the lower back like that. So that's the only thing going through the center, but like it's just pinned there. I mean, it's pushing everything else out of the way.
So Michelle, is this like a cancer tumor?
Yeah, for it to be this big, I mean, there's just not that many things that are going to be this big and not be cancer. Now, again, technically, you need a biopsy to know for sure. You know, without doing a biopsy, you don't know for sure. My guess is that this is in the spleen. The spleen is an organ that you don't have to have. So some people will choose to have these, try to remove them. And sometimes we can successfully do that, and sometimes we can't. When they get to be this size, like I said, they're taking up so much space. I mean, it's a pretty major surgery. They have to get cut from stem to stern to try to get this out. This thing is probably, again, it's probably this big inside of there. Like I said, I was pushing on one side and I could feel it bouncing off my other hand like a basketball in there. And because of that large size, again, it's very difficult to remove it. And the other question is whether or not it's adhered to any other important structures. So sometimes you get adhesions to those loops of bowel, and you can try to gradually peel those away to salvage the things that you need to keep and just take out the thing you want to take out. But again, there's also risk in that there might be sections that are completely tangled up in it that you can't remove.
So is it because, in your experience, being a veterinarian, this comes with age?
Age, and I'm sure that there's a hereditary component to this. It's just we don't have that information like we do with humans, right? We know what aunts and uncles and grandma and grandpa and mom and dad have. With these guys, we rarely have any kind of family history.
Could this have been prevented? No.
can it be shrunk?
No. You can, like I said, you can try to go in there surgically and remove it.
Medication, can it?
No. There's medication that you can give them after you remove it. Like if you take it out and you biopsy it, confirm what kind of cancer it is, then there's chemotherapy just like there is for people, for dogs.
No.
And the chemotherapy's job is to try to kill any little cells that might be floating around elsewhere.
That makes them very sick.
Yeah. I mean, just like chemotherapy in people.
Yeah.
Now, they do it differently in dogs because dogs don't understand, right? So it's almost like chemotherapy in little children. They don't give them enough chemotherapy to cause them to get really, really sick. So their goal is to give as much as possible without making them physically ill. But still, it's, you're giving them chemotherapy. It's a poison in their system trying to target those specific cancer cells. And the problem is that most of the time, by the time we diagnose these, they have already metastasized to another location, even before we find them. Oh, wow. So, again, you can remove this large mass, which does take the pressure off the intestine, but then how much time do you get, right?
And what's his quality of life? Well, does he even recover?
Right, does he even recover, right? So first you have to survive the surgery, which is already a big deal, and then after that, are you just going to grow something else 3 months later? Then you have another cancer in another location.
What is your suggestion?
Well, you kind of have two options. So one of them is that you can do the quality of life option, which is where we can give them medication to try to help with nausea and queasiness, and medication for diarrhea to try to keep him as comfortable as possible, pain medications, things like that. And we can see how he does with those supportive care medications and try to maintain his quality of life. Or, like I said, you can go through and have the big surgery and everything done and see whether or not you can get this removed. Just knowing that, number one, he might not make it through surgery, and number two, even if you do the surgery, he might not make it another few months after that because most of these have already spread somewhere else.
So probably option number one would be to try to keep him comforted with medication.
That gives us more time with it. Is he suffering?
Well, at this point in time, again, with him not eating great and having the diarrhea, he is, but he might respond to medication. So we could put him on some of those supportive care medications just to help his intestine feel better. Okay. And if he responds to that, then he might do okay for a little while. Yeah. There's two big risks that you have. A little while might be a month. So, yeah, we're not looking at probably more than that. There's two big issues that might happen. Number one, that he doesn't really respond to the medication at all and he continues to not do well, in which case I would say he's definitely suffering and we probably need to make the decision to say goodbye. Or number two, sometimes these things will rupture. And when they rupture,
that was Tank's issue.
Yeah. I mean, literally, they will just start hemorrhaging internally. You will not see any hemorrhage from the outside. It's not like there's going to be vomiting blood or pooping blood. The blood is going to fill this abdominal cavity up, but they are still bleeding to death. And again, that you could go to bed at night and he could wake up in the morning, or you could wake up in the morning and he's passed away. That can happen that quickly. Now, sometimes they have a hemorrhage and then the body manages to patch it up. So they will go through these periods of time where they're kind of wobbly and a little bit unsteady, and you lift up their gums, instead of being nice and pink, they look kind of pale. And then the body manages to put a clot on that, and then they regenerate the blood and they do okay. So it's like a little roller coaster ride, right? We have a good day and then suddenly we have a bad day. And then a little while later, we have another bad day, we have a good day, So it goes up and down like that. But if it starts to bleed and his body's not able to put a clot on it, he will die, Or he'll get to the point where he's struggling to breathe and his gums are pale and you guys are rushing him in on emergency, either to us or to someone in the middle of the night.
To put him down.
To put him down.
Yeah.
Or, again, to have surgery to stop the bleeding. I mean, one or the other, right? And again, at this point, if we've decided not to put him through the big surgery, then it would be to put him down.
Which the surgery, my understanding of what you're saying is kind of futile.
Well, yeah, because again, most of the time they've already spread. So, I mean, sometimes people will say, well, I want to get the surgery done because maybe we'll have more time with them. At least it won't be pushing on things, that sort of thing. But like I said, sometimes they don't make it through the surgery either. So most of the time, the clients I have that make the decision to do surgery are the ones that are actively bleeding. Because the dog's in an emergency situation and either you've got to do surgery or you've got to put him to sleep, and they're not ready to put him to sleep yet. So that's typically the times where I end up having to do the surgery. Whereas in this case, he's not actively bleeding today. So you guys have time to think about this.
So you're also the surgeon?
Yeah, we would do the surgery here.
So we would get the medicine today.
Correct.
And take him home and spend some quality time with him.
Right.
And see if he feels better.
Yes.
Maybe come back in a month or...
Just depending on how things are going, yeah. I mean, again, if it looks like he's doing well and he's responding to the medications, then we might refill those medications for you and kind of keep going. I usually don't follow up with any x-rays or things. Again, it's not going to change what we do.
Yeah.
Everything is focusing on hospice. How is he doing? How is he feeling? Are there things that we can change or adjust to help him feel better? Or are we at the point where he's not responding to the medications and we need to start to make that decision to say goodbye?
And if he's not responding to the medication, how do we know that?
You're going to continue to see all the same symptoms that you're seeing now. The diarrhea, the not eating, vomiting, those kind of digestive
So if he's
signs.
responding to the medication, then he's going to have good bowel movements. His appetite will come back.
Correct.
And we maybe have a month left with him.
Right.
Okay. Let's go that route.
Yeah, we can't put him down. He's still got life in him. I mean, he's always been a lazy dog. And he has, compared to his partner.
To be honest with you, in this case, that's a good thing. Because if he gets to going crazy, right, these dogs that get the zoomies, Or when he goes after the rabbit, if he starts pumping blood through that thing real fast, it's more likely to rupture.
So I
If
need
he,
to quit chasing rabbits.
Yeah, I would have him not do any really extreme
Okay.
exercise like that. If he tries to, jump over a tree branch and hits himself in the belly, that can cause it to start bleeding. I mean, it's like a ticking time bomb, right?
Oh,
Now, he
yeah.
can't live in a bubble. So I don't want him to have no quality of life and to be, treated with kid gloves necessarily, but there are some things that I would probably not have him do. Like I said, the running around, any kind of parkour where they're doing like jumping over
What
things.
about? Well,
But-
he's not going to jump over anything. But
But routine walks and stuff like that, that's fine. I try not to do any jogging or running or anything like that.
Okay.
Now I will say he's got a bad back and he's got arthritis in his hip
I've
too.
noticed
So.
that.
really,
Yeah,
I've
this
noticed
hip
that
right here, which
sway.
it's not really hip x-rays, but I just caught the edge of it. This hip's more normal right here. You can see that ball and socket joint fitting together nicely. And then this hip over here is just really arthritic on this right side. So he's got all this extra bone. So it's just the right hip, it's not the left. And then this one, you can see his back a little bit more. And when you look at his back, see all this extra bone down here underneath each one of the spinal bones, and then up here under these spinal bones. All of that is just, again, indication of chronic kind of arthritis type changes inside of the back.
so when do you think we could start seeing some improvement when you start giving him medication?
Well, my hope is within about 3 days, you're going to see him doing much better.
Okay.
So I feel like if he's going to respond, he's going to respond in the next week.
But in reality, he maybe has a month or 2 months, maybe at the most.
I mean, sometimes they surprise us, and
Yeah.
they do really well. And like I said, we'll keep refilling the medication if you guys feel like he's doing a good job at home and responding